Hi, I'm Azatadine, and today I am going to share with you my autobiography. So first, let's talk about my drug name. Again, I am Azatadine, and my brand names are Optimin, Zadin, and Trenalin Revitabs tablets. And my chemical name is benzocycloheptapyridine. And now, let's talk about my drug classifications. So, I am considered as anti-allergic agent for my therapeutic classification. Also, my pharmacologic classification is that I am a histamine H1 receptor antagonist. You might be wondering if I am allowed for pregnant women. For you to know, I am under pregnancy category C, which means that animal reproduction studies have failed to demonstrate a risk to the fetus and there are no adequate and well-controlled studies in pregnant women. My mechanism of action. I appear to compete with histamine for histamine H1 receptor sites on effector cells. The antihistamines antagonize those pharmacological effects of histamine which are mediated through activation of H1 receptor sites and thereby reduce the intensity of allergic reactions and tissue injury response involving histamine release. Tada! Let's talk about my pharmacokinetics. Absorption. If I am taken orally, I am absorbed from the GI tract. Peak plasma concentrations occur after 4 hours. My distribution. Sadly, information about how I am distributed in the body is not available. So now, let's talk about my metabolism. I have minimal metabolism and also, I am metabolized in the hepatic system. Lastly, my excretion. I am excreted via the urine and also, my elimination half-life is 9 to 12 hours. Now, let's talk about my indications. I am indicated for the relief of the symptoms of upper respiratory mucosal congestion in perennial and allergic rhinitis. And there's more, for the relief of nasal congestion and eustachian tuberculosis congestion. If I have some indications, I also have contraindications. I am contraindicated in neonates. Also, in patients receiving monoamine oxidase inhibitor therapy. I am also contraindicated in pregnant and lactating women. Now, let's talk about the side and adverse effects that I cause to the different body system. In the central nervous system, I cause dizziness, drowsiness, headache, fatigue, nervousness. In the peripheral nervous system, I cause impaired alertness. In the gastrointestinal system, I cause increased appetite, weight gain, abdominal pain, nausea, and diarrhea. In the musculoskeletal, I cause arthralgia. In the respiratory system, I cause thick bronchial secretions. For the eyes, ears, nose, and throat, I cause dry mouth. So in the digestive system, I cause pharyngitis. Now, let's talk about the nursing responsibilities. Before starting therapy, it is important to assess the patient's condition and ask if the patient has glaucoma or increased pressure in the eye, stomach ulcer, an enlarged prostate, bladder problems or difficulty urinating, hyperthyroidism, hypertension, or any type of heart problems or asthma. Also, it is important to assess patients' and families' knowledge of drug therapy. During drug therapy, inform patient the maximum amount of azatadine to take in 1 day is 2 mg. Tell patient to take each dose with a full glass of water. Warn patient to use caution when driving, operating machinery, or performing other hazardous activities. Tell patient to store azatadine at room temperature away from moisture and heat. Monitor vital signs and ECG. Educate patient about the drug. Also, auscultate breath sounds. Monitor vision changes. Also, you need to observe signs of renal toxicity. Inform the patient that azatadine may be taken with or without food. Also, it may be taken with food or milk if stomach upset occur. Report nervousness, restlessness, insomnia, diaphoresis, mood changes, and thirst. Suggest sugarless candies. Increase humidity and push fluids. Have the patient void before each dose. Provide skin care. Tell patient not to switch brands or take other prescription or over-the-counter drugs without prescriber's approval. After drug therapy, Advise patient to report sudden physiologic changes such as for possible drug side effects or drug withdrawal symptoms occurrence.